Well, this is scary. The CDC is warning about a global uptick in measles cases. This health alert comes as the spring and summer travel season is kicking off. The agency is calling on doctors to encourage vaccinations, especially for children traveling internationally. The U.S. eliminated measles as an endemic, but some imported cases are seen annually.
Joining us now is pediatric infectious disease specialist with Kaiser Permanente Orange County, Dr. Daisy Dodd. Good morning, Dr. Dodd.
Good morning.
Thank you so much for joining us, and let's get right to it. First of all, doctor, what is causing this outbreak?
Well, definitely this outbreak is being caused by the decrease of immunizations. We've recognized that in order to be fully protected and have herd immunity, you need 95% of the population immunized. We have about 92, 93%.
Okay, and so let's talk about those vaccinations. When should adults and children get this vaccine, and how long is it effective for?
Yes, in children, we offer immunizations typically at 12 months of age and then between 4 to 5 years of age. Obviously, adults that were born prior to 1957 have natural immunity, and they don't necessarily need to be immunized.
This is, of course, a concern across the United States, but let's discuss how we here in California are being impacted.
Yes, we're very much impacted. We know that nationwide there have been 58 cases reported in 3 months, probably close to what was reported last year in the full year. So we're seeing a significant number of outbreaks. So it's extremely important to immunize, because measles is very contagious.
Yeah, it is contagious, and since it's not something that's super common, it's coming back now. I don't think people know how to recognize it. What symptoms should people be looking out for?
Yes, typically it can be misconstrued to be just about anything, because once you're exposed within 7 to 12 days, particularly the child who's not immunized will have runny nose, cough, red eyes, and within 3 or 4 days, then they will get what we call the morbilliform rash. So it will be that much more obvious to the clinician what it might be. The thing is that prior to the appearance of the rash, you might have already been infected because 4 days prior to any symptoms at all, the individual can be contagious, and even 4 days after they begin to recuperate, they are contagious. It's also extremely important to understand that measles is much more contagious than COVID might have been. The person that comes in contact with 10 individuals, 9 out of 10 will actually develop the infection. And even when that person walks out of the room, the virus remains in the room for up to 2 hours in surfaces and in the air.
And finally, Dr. Dodd, should we be concerned about this?
To a certain degree, we should be concerned to the point that we need to encourage particularly parents to immunize their children, because we do know that measles can lead to pneumonia, it can lead to infection in the brain, and yes, people can die from measles. So it's just as simple as immunizing. If you're going to travel with a young child, they can be immunized as young as 6 months of age, with a booster being given by the pediatrician later on. So let's go out there and get immunized.
Definitely. Dr. Dodd, thank you so much for joining us. This is scary, but the answer's right in front of us. We have the vaccination available. People just have to get it. Thank you so much for being with us this morning.
You're very welcome.